touch on a lot of things. When you go to see your doctor, you have like 15 minutes, right? In and out. And if you come with a list of questions, we'll can help you if there's time to answer all those questions. One of the benefits of centering is that you have an hour-long time with the doctors. You have the one-on-one time where you are with your doctor to ask all your personal questions, and then you join the group of women with whom you are due at the same time, and you get to talk about anything and everything. Then there is snacks, right, Stephanie Jimena? You get to eat together, you get to fellowship together, and then you have the likes of Bed from Lactation, you have Family Connect, you have resources from TASK, we even just talk to people from your end, doula group. They will come and talk to you about doula support when you are in labor. You know, you have week for breastfeeding. You name it, we have it. And then you get incentives every time you show up. Then we have this reunion afterwards, and you get friends for life. Yeah. Because those groups that you are there together, you have become friends. We have women going to each other's baby showers after, and their kids are growing up together. But I'm not one of the century moms, because I'm not going to be pregnant. So that is another adult. That is Miss Mutiat. Where are you? All right, come on. She's an alumni graduate of October 2019.
Hey y'all! Hey! How's everyone doing today? So I joined centering because of the snacks. How about that? So I was seeing Dr. Nala, and I had seen like flyers at the clinic about centering, and I asked her about it, like what is this about? And she kind of gave me a lowdown about, you know, how the women would meet up and talk about, you know, their pregnancies and all that. I'm like, man, that's really cool. So I signed up for centering because I just felt like it was important to have that community, people that you were going through the same things with at the same time. You can share, you know. I wasn't a first-time mom, by the way. This was my 4th pregnancy. I had my other kids in Chicago. So I was like, well, every pregnancy has been different, you know what I mean? So just sitting around and being able to talk to other women going through the same things and sharing things, I'm like, so I'm not alone. Because sometimes it feels like, man, I'm just going through the worst and, you know, everybody has it good. It's not always like that. So yeah, it was kind of nice. So that was why I joined centering. And I gained a whole lot from centering. I'm a registered nurse, by the way, but when it came to all that baby stuff, I didn't really know too much, I found out. So we learned so much. You're able to ask so many questions. I found out pretty early about me having twins. I have twin boys. And it was kind of scary initially. I was like, man, I'm having twins. But I always felt so confident just going there. They did blood pressure checks every time, like your complete vitals, the weight, and just the scans. I was loving that because when you're going through your regular, you know, maternal stuff, you get maybe 1 or 2 scans. But when you're in centering, you can see your babies every time in the heartbeat. That was very comforting for me. So, and like no, oh, baby A is here, baby B was here. I wouldn't trade that for the world. Also, just being able to ask questions, like you said, like Dr. Nala was saying, you get 15 minutes with your doctor. But being in centering for an hour, a whole hour, with other women, just sharing experiences. There had days where we just asked questions, you know, birth control, which I know I definitely needed. Because my twins were number 4 and 5. That's my older twin right there. He's the more quiet one. So you can imagine what the house is like. Yeah, so that was like just amazing to be able to ask like different questions. They gave you so many choices. They even provided like transportation, you know, like people that couldn't get to appointments sometimes. They would talk to you about helping you get to your appointments and stuff. I feel like that's really important. Like Jamila said, postpartum stuff, like those are like some really, really, really crucial things in pregnancy that people don't think about, you know. A lot of women come out of, you know, having babies like super depressed, but centering like follows you all the way through. till you have the babies, and like kind of all that follow-up and all the friends that we made. Like I said, I wouldn't trade that for the world. That's the other twin. Yeah. Let's see. Yeah, and like comparing it to, like I said, the regular regular prenatal visits, I definitely would choose centering over and over again. I'm not trying to choose it over and over again because I'm done. I didn't have anything clipped, nothing's burnt, but I am done. I'm grateful for the 5 I have, they're beautiful. But yeah, centering is so much more than just, like I said, just your regular visits. Like I said, the community, the togetherness of all of it. Yes, I will do it again, but I'm not planning to. And I definitely encourage anyone that is pregnant, planning to be pregnant, to definitely check out centering. You would not regret it. And like I said, it's free or maybe it's covered by insurance, so why not? You're getting a whole lot more than you'd be losing, And like I said, they provide transportation, they help you get there, and there's snacks. So yes, join Centering Pregnancy. Good luck.
Thank you. Miss Stephanie, where are you? All right. Miss Stephanie sits in all the sessions. She's one of the co-facilitators. We have 2 of them. Imelda, raise your hand. So there's Imelda Lopez and there's Miss Stephanie here. Part of their role, apart from sitting in on the sections, you have their phone number, so you have direct contact with them. They will remind you of your appointments. You can ask some questions and they will direct you to the doctors. If you forget your appointment, they will reschedule you for another one. You name it, they do it. And they do a lot of outreach beyond your visit. They don't just stop with your visit. So Stephanie, take it away.
Good afternoon, everyone. My name is Stephanie Irvin, and I'm one of the co-facilitators of Centering Pregnancy. My role as a facilitator, first of all, I get things prepared for the facilitator to come in and take care of the patient. I sterilize everything. I make sure the snacks are provided, the incentives are provided, and most of all, I do a lot of recruiting. My job is to basically establish a rapport with each patient, and I think I do a very good job at that. Being a young mother myself, I'm a mother of 6 kids. My first son, he's 36 now. He weighed 2 pounds and 6.5 ounces. I didn't have a lot of support. I was scared, terrified, and I really didn't know the ins and outs of being a mom or just even being pregnant. And so they didn't have a lot of support groups or anything like that when I was having my kids. I know I look good at 52. But and so when I got this job, I was like, wow, I can't believe that some of my own personal experiences relate to what we're trying to prevent, and I'm so grateful for that. I find that most of our patients, I have a personal relationship with them. I do a lot of phone calls, like a lot. Like I remind them of their appointments and things like that. And sometimes if one of our patients have a personal issue that they may not feel comfortable sharing with the doctor, I can relate with them on many different things. And I'm very and I'm not judgmental in that regard. Centering has helped me actually become a better mother, a better grandmother. I'm able to share the information that I learn in each session to other people because I'm involved in a lot of other entities, and I'm also grateful for that. Centering, for me, overall summarize of centering, I can say that centering, a lot of young ladies that I meet, it's their first pregnancy, and a lot of the sessions, you're scared, you don't know what to expect, and so we have speakers come in and talk about nutrition, as they said, postpartum depression. Also, we've had some patients that went through some domestic violence, and I've had some of those situations occur in my life, so I share a lot of my own personal experience, which allows patients to open up and share what they're dealing with. And so I just want to say for anyone that's watching or listening, give Centering a chance because it can really help your prenatal experience be the best. I'm truly honored to be a part of such a great team.
We have a Facebook site. We have an Instagram. Thank you. our only two main groups.
That's it. You can Google us on centeringpregnancypeoria.com, and it has some of our recorded sessions there. You have the contact numbers for Jimena and Stephanie there. You can reach us. You can sign up if you want to be a patient at Heartland today. The Heartland table is here, and we will find what group you belong to. If you know somebody who is pregnant, doesn't have a doctor, check us out. We love delivering babies. We don't just close. Jamila. All right. Thank you very much.